Hi, my name is Dr. Frank Gergits from Sinus and Allergy Wellness Center. Today I'd like to talk about a few new items that we have at our disposal to treat patients with nasal polyps. You may have been diagnosed with nasal polyps in the past and may be frustrated because polyps come back. Unfortunately, polyps, there is no cure, so we treat polyps almost like we treat patients with allergies or asthma or diabetes. We can treat those conditions, unfortunately we can't cure them. When nasal polyps come back, oftentimes patients have been referred back to the ear, nose, and throat doctor and may have had suggestions for more and more surgery. While surgery is one item that is definitely a benefit to patients who have nasal polyps, doesn't mean that we have to keep using surgical options, especially if the first surgery that was done was an effective, good surgery. How do you know that if you've had a good surgery in the past? Well, that's where we can help. Sometimes we'll do a CAT scan to check the sinus cavities to see if there's any partitions or any further sinus surgery needed where the polyps could be anchored to those locations, causing further growth. So if there's still some polypoid changes inside the nasal cavity or small areas of sinusitis, surgery may be needed for a second approach. But if not, then we have different items that may be worthwhile to incorporate to see if we can see improvements with the polyps and not need further surgery. The first is a product called XHANCE. XHANCE is nothing more than steroid nasal spray, which is Flonase, used inside the nasal cavity in a new delivery device. Today I'm going to show you how this product is helpful for patients who have nasal polyps. When you get this in the mail or from the pharmacy, there's a nasal applicator, there's a straw that you blow air into. The bottle has the Flonase inside, so when you push the bottle into the housing as you're blowing air through this nozzle, it delivers a steroid medicine much more effectively into the nasal cavity. I'm going to show you now how it works. The nasal appliance goes inside my nose. As I blow air and I push this bottle down, one spray each nostril morning and night following a saltwater rinse much better delivers this Flonase into the nasal cavity in a way that it's going to help to eliminate polyps. So this is a new product available for patients with nasal polyps that may help to reduce polyps without having further surgery. Another option is a product called Propel and a product related to Propel called Sinuva. Those are small little inserts that go into the sinus cavities where polyps are, and over the course of time, that polypoid changes inside the nose are reduced by the steroid that's eliminated from that dissolving implant. Propel dissolves in 12 days. Sinuva dissolves in 60 to 90 days. The 60 to 90 day insert is performed here in the office, as is Propel. That can be done easily with local anesthesia. You could drive to the office, we could do the implants, and you could drive home. Those implants start to work pretty quickly and help to resolve polypoid changes inside the nose and sinus cavities. The third new item that we have is biologics such as DUPIXENT. Nucala is another one, Facerna is a third. These nasal medications are actually injections that are injected into the body, usually into the belly region, and with that medication, as time passes, it helps to reduce the polypoid inflammation from the IgE and other triggers for polypoid changes. So those injectables are helpful for patients who may have asthma as well as polyps, or who just have polyps in the nose and have not seen benefits from the other therapies that we've already introduced. So again, if you're a patient with nasal polyps and we're told that you have to live with these polyps, that's not the case. There's new therapies that we can easily begin in the office to try to see if we can make some improvement and impact in your nasal breathing. The second thing is surgery. Do you need to have further surgery? Maybe not. Maybe the Propel could be placed inside those sinus cavities, or the Sinuva to help reduce the polyp burden inside the nasal cavity without having any surgical removal of tissues. And third, if you're the patient that's been through those other two or has severe pollen sensitivity, severe asthma, and severe nasal polyps, maybe a biologic injection may be helpful to reduce the polyps and help you feel better as far as airway breathing goes and airway inflammation. So if you have nasal polyps, think of Sinus and Allergy Wellness Center. Thank you.